She's worked with Julie for, well, since January of 2003, since we started the program.
Helen's diagnosis is Down syndrome with some overlays of tactile defensiveness and sensory processing issues. Tactile defensiveness is the body's perception of input, usually in the form of touch, that is altered from you and I, in that it impacts the child's ability to function with their daily living skills. The decision for Helen to transition into pool-based therapy was recommended by her 2 land-based therapists as an option other than discharge.
Thank you. Ta-da! I think Helen, like a lot of children her age, just benefit from routine, and I think in those ways it's helped a lot.
What's very nice about it is for somebody that has difficulty on dry land therapy or has problems with social interactions or transitions, you have a nice one-to-one environment here so that they're not distracted.
Give Julie a little kiss with the duck. My turn.
With Helen, her tactile defensiveness is largely seen in her skin receptors, especially in the soles of her feet and on her hands. I do a lot of sensory types of activities to give her input to assist her in getting into a calm state and stay regulated so that she can participate in some of the functional activities that I like to set up for her. The other things that we try to touch on is following just simple directions, and they're getting more complex. Initially, she was so orally defensive you could not really get anything into her mouth. And the nice thing is now all I have to do is give her the Nook brush, we play the little game, and she self-initiates that. The treadmill has been a goal that I have just had for her within the last probably 2 months, and she's realizing it. Really, I'm not working on gait per se, but I'm working on just her ability to cognitively process what I'm asking of her, follow directions, and do it in a safe, balanced manner. The changes that I've seen with Helen over the course of time have been remarkable. Her ability to interact with me has increased tenfold.
She's beginning to show a lot of improvement in following 1, 2, or 3-step directions. It's something that Julie works on in the pool with Helen. She's also comfortable with the routine and knowing Julie Mortenson. Julie is wonderful, so I know she looks forward to it.
I try to pick up on the mood or the affect of the child and read that and then try to interact with that. It's kind of a dance. It's a therapy dance.